First at 5:30, an FDA advisory committee has recommended modifying COVID-19 booster shots in an effort to target some version of the Omicron variant. Thank you for joining us. I'm Mike Montecalvo.
And I'm Chelsea Jones. Yesterday's vote did not approve new vaccine recipes, but it paves the way for the FDA to push manufacturers to create them ahead of an expected winter surge. 12 News reporter Alexandra Leslie has new reaction from a local doctor. Ale.
Chelsea and Mike, the chief of infectious diseases at Rhode Island and Miriam hospitals, explained that while the shots should be adjusted to keep up with the virus, that the strain of COVID we're dealing with now will likely not be what we experience in the fall or winter. The FDA will still have to decide the exact recipe of modified COVID-19 booster shots, but an advisory panel of doctors indicated it will be a combination shot with protection against either Omicron or some of its subvariants.
We may at least bring the immune system closer to being able to respond to what's circulating.
Dr. Eleftherios Milanakis, chief of infectious diseases at the Miriam Hospital and Rhode Island Hospital, explains that the process to update COVID shots is not like it is for influenza shots.
A few months before the flu season, we have an understanding of what is circulating in the southern hemisphere, and then we can make probably a reasonable hypothesis and guesses of what we are going to focus our vaccines.
However, Dr. Milanakis explains the virus that causes COVID-19 hasn't become predictable yet.
It still changes drastically.
He says while all the current vaccines still provide a level of protection, those who were vaccinated are facing waning immunity, and only about half of Americans are up to date. It's in part why he is expecting an increase in cases in the months ahead.
So we need to adjust, and hopefully with the new Omicron-focused vaccines, we're going to have a good response that will stay for a longer period of time and will be able to help us over the next few months.
So right now, it's still not clear who will be offered this modified booster. The shots might only end up being recommended for older adults or those at high risk. Live in studio, Alexandra Leslie, 12 News.